recently there are videos that are going viral on social media talking about doing treatments of going inside the mouth to the lateral pterygoids and the medial pterygoid muscles. And during the video, people are having huge emotional releases. And this is what does happen. It happens quite frequently in neural organization technique. The way we look at things is the right jaw is an actual neurological emotional pain filter. So if we had a divorce when we were young and never really processed it, or had sexual abuse, or whatever the trauma was, and we didn't really get to release it, what the body seems to do is filter down the intensity of the impulses that hit the body from the brain while you're thinking this process through, while the divorce is happening, for example, or how the body is affecting the brain. And this is done so we can go forward in life. If you didn't have time to process it, you got to get back in the jungle. So we lock it in and filter it through that right emotional jaw. The left emotional jaw is a physical pain filter. So if you got in a hard car accident, or you almost went, or you did go unconscious, or almost went unconscious, the body is disorganized, but it has to survive in life. So it says, I've got to filter the intensity of the pain messages going from the brain to the body, body to the brain. So that's the left jaw. Now, if you go in and attack that and try to release that, yes, you'll get these kind of releases and the body disarms. However, in neural organization technique, and that's why we called it neural organization technique, because there is an order and a neurological priority to how to work with the body's intelligence. And so my only caution in these kind of things is we feel that it's the cranium that rules the body. The head rules the body. So if you go and look at the videos I've made talking about concussions in the cranial injury complex, the reason why the masseter and temporalis and the pterygoid muscles are armed is because you sustained a trauma, went into defense, and the body's saying, until the cranium is reset, I will keep these jaw muscles tight to keep the brain shrunken down. I will throw my tail up in the air, which locks down the whole pelvic system, just like a cat or a dog, and I'm stuck in the armed defense pattern. And that has to be neurologically corrected, in my opinion, in order, which means first do the head, then you will have much more success with the jaw release and coccygeal release. This is the order we work with in N.O.T. And therefore, we should not harm the patient or be careful, because if you go in and go straight to this, you could be opening up a can of worms.